My one word to describe Cushing's disease would be complicated.
Massive.
Misunderstood.
Complex.
Sucktown. It seriously sucks.
It's devastating.
My one word to describe Cushing's disease will be debilitating.
Early symptoms of Cushing disease include weight gain, mainly in the midsection. You can also see fat accumulation on top of the clavicle, in the back of the neck. Other symptoms are fatigue, weakness, problems sleeping. In female, we can also see irregular cycles. Patient can also develop hypertension and diabetes. It is hard to diagnose Cushing because many of the symptoms that I just mentioned are also associated with other conditions in the population, like obesity, metabolic syndrome, PCOS, and diabetes. So it's hard to differentiate, and it's very important to have a high index of suspicion.
I didn't notice the symptoms to start with until my GP raised concerns about 3 years in. I'd not long hit 30 and had been told it's all downhill from here. Plus I'd changed from a retail job to a sedentary office job, so I expected some weight gain. I had slow weight gain, in total 5 stone over 4 years, so it didn't seem out of the ordinary. And as I'd never been overweight, I didn't realise it was an odd distribution of fat. I suffered a DVT a year into the symptoms, but I was found to have a genetic cause, and this just further masked symptoms, as brain fog, lack of concentration and memory, and high blood pressure can all be symptoms following a blood clot. I did realise I was going to the doctor more for minor problems when I never used to go for anything. Eventually, I had a foot issue, and the podiatrist recommended some blood tests based on very dry skin. When receiving my results, my GP said I didn't look right. I sheepishly said I'd gained a stone, but she said this wasn't normal weight gain. With her questioning, I realised I had the round red face, stretch marks, weight gain, irritability, and many other small, seemingly insignificant symptoms that all added up.
With Cushing's, the symptoms can start without taking much notice. They're non-specific and don't cause much alarm. But the symptoms that I remember first noticing was my hair thinning and my mind feeling stress and having insomnia.
I slept very bad and my sleep was really affecting me. So I had developed insomnia, and that's also when I started to visit my doctor pretty frequent.
It was back in like 2009 when I first started to notice symptoms. I was misdiagnosed back then, and it's actually pretty difficult to get diagnosed for Cushing's because so many of the symptoms overlap with other things. But it became incredibly obvious last year in 2024 when I noticed I lost over 80% of my hair and I started losing muscle like crazy, and that's when it just became super obvious there's definitely something wrong.
I was always feeling tired, always unwell. I was putting on weight around my face and around my stomach. And I went to a lot of doctors. I went to basically every ologist under the sun. I got various diagnoses. And so, yeah, it was a 20-year journey to diagnosis. But yeah, initially it was just various symptoms which masked as other things. So I was diagnosed with polycystic ovaries, diabetes, irritable bowel syndrome. Yeah, so it was just various symptoms that masked as potentially other diseases.
Cushing diagnosis is mainly used by using laboratory evaluation. Per guidelines, the diagnosis is based on at least 2 out of 3 different tests showing elevated levels of cortisol. The first test is the late-night salivary cortisol, when we check the cortisol level at around 11 p.m., just before bedtime, when your body is relaxed and getting ready to sleep. Then we expect the level of the cortisol to be very low. Another test is the 24-hour urine collection, where we measure how much cortisol the body produces and secretes. And the third test is the dexamethasone suppression test. where patients take 1 milligram of dexamethasone at 11 p.m. and we check the level of the cortisol the day after. Same here, we expect very low levels of cortisol because giving dexamethasone suppresses the pituitary adrenal axis. We also use imaging to diagnose Cushing disease if it's a pituitary adenoma.
After being diagnosed with Cushing's disease, I had surgery to remove the tumor. It was a horrible time for me during recovery and took much longer than was originally told. But once I got over the initial recovery, I started having other symptoms that I didn't have before diagnosis. I was then diagnosed with Graves' disease and feeling weak and nauseous, and I felt really fatigued, and I would sleep at least 9 hours without feeling rested. I had brain fog and gut issues and just unable to sustain exercise beyond 15 minutes without feeling lightheaded. This led to the diagnosis of growth hormone deficiency.
So initially I had some blood tests which for a medical examination for an insurance, and I failed the medical because I had a high white cell count. So I went to the GP, and before I could even sit down, she said, "You've got leukemia." So that was quite a shock, but I went to a hematologist who was a very perceptive hematologist who knew some of the endocrine conditions, and she looked at me, the moon face, the thin skin, the hump on my back, the weight around my stomach, and she said, "I think you've got Cushing's disease." So we did those tests. I didn't know what Cushing's disease was at the time, but I just was glad that I potentially didn't have leukemia. After 20 years of not knowing and not having something with a name, I was kind of relieved that I actually had something with a name and something that I could potentially treat. After that came all the emotions after I went to Google and found that, it seemed very daunting in the fact that I would have to have brain surgery or transsphenoidal surgery, and there wasn't a lot of information. It appeared on people with around my age with the condition. So it was a mixture of relief and also fear of the unknown.
It's taken a long time for me to get to a diagnosis of Cushing's disease, which finally happened at the end of 2024. I first presented to an endocrinologist in 2016, so 8 years ago, when I had blood clots, a DVT and multiple pulmonary emboli completely out of the blue. The scans for the blood clots revealed an adrenal adenoma, so that was my first referral to endocrinology. It was only because an incidental investigation that a urologist advised retesting of the adrenal adenoma. As he said, it's common for them to become active within 5 years. So those tests were very similar to the ones in 2016, but because of all the other problems I developed, the adrenal endocrinologist felt that it was probably significant this time and needed further investigation. So a scan of my pituitary revealed a pituitary adenoma, much to everyone's surprise, and then an IPSS test revealed that this was actually secreting ACTH and was the cause of the hypercortisolism. So officially I have a diagnosis of Cushing's disease. So this took 6 years.
When I was first diagnosed, it was a huge relief just to have a name and an answer to what is happening to my body. After that, when I did a deep dive to find out more about Cushing's, I became incredibly distressed because first I didn't know how rare it was, and then secondly, I also didn't know how dangerous it was. And so with the increased risk for stroke and heart attack and the way that your body can deteriorate so quickly, I just had no idea. And so my initial concerns were, how are we going to stop the deterioration of my body in time? And am I going to be able to find a team near me to be able to handle it because it's so rare?
I went undiagnosed over 10 years, and I was just diagnosed about 8 months ago. And during all the time, that I was not diagnosed and that I had no idea I had Cushing's, it was very difficult trying to deal with all the different side effects that Cushing's has on your body, and trying to follow all the suggestions from doctors, whether that was physical activity, having a healthy diet, and any other suggestion that might come along, and not having any type of progress was very difficult to understand. So it really felt like I had very little control for my own body, regardless of what I did.
When I was diagnosed, I cried. It was a relief to know what was wrong and that it could be treated, but it was scary. I'd always been so healthy and suddenly I had a tumour. A benign one, but still a tumour. That word's scary. I knew it meant surgery to remove it. I knew it wouldn't be a quick treatment, and I knew it could return. My concerns were over the seriousness of the surgery, how much damage had already been done, and how long would it take to heal.
After almost 5 years, and at that point my health was really bad. I could hardly walk. I had gained so many kilograms. I went from 67 to 110 kilograms. My face was getting very round and I had severe skin problems. And I was really looking for a solution. I was also very depressed at that time. So in December 2020, when I finally got to see an endocrinologist, and she told me that I think you have something called Cushing. I was prepared and I was so relieved. That was a relief that I had never felt before. I was happy to have a serious illness because I was so tired of not knowing and so tired of visiting doctors in different hospitals and my GP with no answers, and with the message that I had the wrong lifestyle.
The first-line treatment for Cushing disease is surgical resection. However, if there is still a lesion due to persistent disease, an inability to resect all the lesion by surgery, or recurrent, or any other condition that prevent the individual from having a surgery, then there are two other options: medical treatment and radiation. They can be used together or separately. The side effect for surgery may be infection, bleeding, and it can lead to hypopituitarism, meaning deficiencies of pituitary hormone. Radiation therapy is also an option and can also lead eventually to hypopituitarism, pituitary hormonal deficiencies, and it can also damage other structures in the body. Medical treatment is also an option, and side effects include adrenal insufficiency, and depending on the agent that you use, you can also have hypertension and androgenism, or elevated androgens.
I've been lucky in my outcome. I regained my natural cortisol production after 3.5 years, so I've now been off steroids for 2 years. I'm almost back to normal most days.
On my second month of the medication and experiencing nausea at times, dizzy episodes, and very fatigued. I'm waiting for another result of a cortisol day curve to see if actually the dose I'm on is sufficient or needs a further increase.
In terms of my treatments, I've had 2 transpernodal surgeries, one unsuccessful and one more successful. At the moment, I've been treated with some medication, and so I guess my goals for my treatment are to make sure that I consistently monitor my condition with blood tests, MRIs, 24-hour urine and midnight salivary tests to make sure that I keep it under control, and if there's any flare-ups to make sure that I can control it and just maintain the quality of life. I think that's really important for Cushing's patients, that it's the day-to-day kind of management of life that we need to make sure that we are able to function, and because otherwise then that can get a bit depressing if your disease or your condition kind of inhibits you from doing the things you want to do. So so I think it's just making sure I keep monitoring it and keeping it under control.
I had the transsphenoidal pituitary surgery, which is surgery to remove the pituitary tumor. And then they put you on medication to manage your cortisol levels after that. How does it affect me? Oh, it's brutal. It's brutal. One thing that the medical professionals were very clear on as I prepared for the surgery is that recovery is going to be just as brutal as having the disease. It's horrible. And it's really rough.
Since my tumor is still blasting out the ACTH hormone, I'm using the block and replace method. With this strategy, my cortisol level is in the normal range and I don't feel tired in the evening. My gonadotropic axis is not working anymore, so therefore I get an intramuscular testosterone injection every 12 weeks. When this is done correct and most of all slowly, I have some muscle pain that day, but then I feel powerful again. Additionally, I take 50 milligram DHEA hormone to support my well-being.
I'm feeling better after 4 years, but I am different. Now there's a sort of anxiety that whenever I start having any loss of sleep or weight gain or some other symptoms that were typical of Cushing's, I think to myself, like, has it returned? Cushing's has been and will continue to be a rough road when we talk about, mental health and things. Patients aren't made aware of the aftermath, even when having had a successful surgery or gone through treatment. There isn't the follow-up or monitoring of my health with my physicians. What I've described is all just because of self-advocacy. It was me that paid attention to how I felt and sought out doctors to help me with my symptoms.
I get more tired still than someone my age usually would. I get more snappy at times and do sometimes struggle with concentration. Mentally, it's affected me a lot. There's a constant worry it will return. Gaining a tiny bit of weight or getting flushed cheeks throws me into panic mode. I'm back to normal work and daily activities, but I had to take 13 months off work while I was too ill. I couldn't do any of my hobbies due to the physical and mental effects for a long time. I struggled to walk unaided. I couldn't concentrate on anything other than very basic TV shows and would forget what had happened in them.
When it comes to emotions, of course, a lot of the frustration and being overwhelmed also brings on a lot of emotions. And even just having to deal with daily activities or having to deal with big news or changes in your life becomes difficult because it's the side effects of Cushing's as well. And that lack of control over your own emotions, it's difficult to explain. It's difficult to understand yourself, let alone trying to explain it to others. So it can affect relationships with friends or families or loved ones, especially when you don't know what's really causing it and you're constantly trying to address it but not having any success. It can be difficult even when others are trying to help, because loved ones might try to offer help, but you might not always know what help you need, let alone trying to explain to others what help you might be needing.
Frankly speaking, compared to other Cushing patients, I am not feeling good. I'm feeling excellent, really excellent. The disease has no effect on my work and all my other activities anymore.
My condition has impacted my emotional well-being and mental health. I think it's been quite a roller coaster over the last however many years, for as long as I can remember, really. So I think that initially you just get on with things and don't actually have time to stop and think what's happening. But after you have some time to kind of, after a little bit of the chaos has died down, it is kind of quite daunting. Throughout the journey, it's impacted me because I just felt misunderstood and unheard when the doctors were dismissing my symptoms, told me I was a hypochondriac, was misdiagnosed, and you kind of felt that maybe it is all in my head. And then once diagnosed, there's not many people who understand the condition. So even though family and friends are very supportive, they don't actually understand what exactly you're going through, because it is constant, and it is, the emotional factors are a lot more. I found the emotional factors harder than the actual physical operation, because it was also preventing me from, I had quite a busy life, and so when I had the operation after it, when I didn't have any energy, I really struggled with that, because I really wanted to do things, and I felt like I was being left behind. So I think that it has had an impact on my mental health, subtle at times and then more pronounced at different times, but it definitely is something that Cushing's patients really have to deal with.
I was lucky with my family and friends. They didn't try to tell me to just lose weight, but they also couldn't understand without going through it. If you try to explain the brain fog, all they have is examples of when they forgot something, but it's just not the same. I was very lucky with my medical team as well. They're a centre of excellence for Cushing's and highly involved in research, but due to time limitations, they couldn't always tell me everything, or I'd think of questions and then couldn't get them over to them. They also can't truly prepare you for how long recovery is or the long-lasting mental and emotional effects. I have the support of a great charity and a support group who provide a lot of information, but if I hadn't found them, I wouldn't have been even remotely prepared to deal with Cushing's.
Once we knew for sure it was Cushing's, every medical professional that I worked with that knew about Cushing's was incredibly helpful.
Since my Cushing was diagnosed 5 years ago, I informed myself about the condition and learned a lot of medicine. I do lab twice a year to discuss the results with my endocrinologist. I am single, independent and strong person. I do manage this disease effectively without additional help. For standard medical issues, I address my local family doctor. For hormone issues, my endocrinologist, and once a year I consult my neurosurgeon. All fine like that.
I do feel it would help everybody if patients were invited to attend MDTs if they wanted to. Although I appreciate this would make them take longer, it would help the patient to feel they're involved in decision making, clarify any confusions, and help people to see who they're dealing with. My medical records make it look like I've got one foot in the grave, but actually I think I'm surprisingly healthy considering all the things wrong with me, and I would like definitive treatment rather than being on a medication with side effects for the long term.
My strategy for coping with Cushing's disease is, number one, having my spouse and other friends be patient and understanding of my limitations, even 4 years after surgery. Because as we all know, that's when healing really truly starts. I also got involved volunteering with Cushing's and got involved with also my local state Rare Disease Advisory Council. Being involved, I think, has allowed me to learn more about my disease and find out how I can impact other people and hopefully drive earlier diagnosis and awareness for Cushing's. So I call that my new normal, and I think it's been easier to understand and accept, and it's really become more of a positive life change.
A few words that I would like to say to patients with Cushing's disease. Be prepared. Understand this is a journey. It is complicated to diagnose. It is sometimes challenging to cure and not always possible. So know that it can take time and can have ups and downs.
Biggest concerns for Cushing's for the future is that there is a lack of awareness out there. So it took me 20 years to get diagnosed. So even linked with primary healthcare practitioners, they need to know so many things and may not come across Cushing's regularly. So the lack of awareness of the symptoms or how to treat it, and also the lack of awareness in the mainstream community, means that there's probably a lot of people out there with Cushing's disease that aren't being misdiagnosed or just don't know about it. And that translates, the lack of awareness translates to lack of support and funding for awareness or support services or access to medications, etc.
One of the concerns I have for the future is any long-term side effects that I might have due to Cushing's disease, as well as the chance of reoccurrence. I did have surgery 6 months ago, and as this time it seems like Cushing's has gone away, but of course there are concerns of reoccurrence, which do worry me. And there's very little that I know can be done at this time when it comes to that. It's just a matter of waiting. But some of the things that I hope can change over time, it's the awareness of this condition, that it's rare. So it's difficult for a lot of people to understand what it is because it's not a common knowledge, which becomes difficult for the patient as well. So hoping that programs like this one can bring a little more awareness to other people and makes it easier for family and loved ones to help them cope with the issues that come with Cushing's disease.